spent the day at the Winthrop Market. It's here in the Tampa Bay area. This is the second time I've tried to, I've gone to a farmer's market. The first time I tried about a month and a half ago. No, I'm sorry, closer to two or 3 months ago. Had some issues with equipment and the canopy. Only was able to interview one person. Was much better prepared now. Got all that knowledge from kind of what I learned from there and took it here. I did end up hiring somebody to help me, Jordan Trowbridge, delightful, intelligent, and engaging young man, helped me through the day. I had him on the podcast as well. But Winthrop Market's a wonderful farmer's market. I had a couple hundred vendors, and it's in this Winthrop Square, and it's a great event. The booth is fairly inexpensive, but the goal, the mission, was to talk to people that I just wouldn't be able to talk to typically, and have great conversations. And I did just that. It was a wonderful, wonderful day. It was a hot day in Western Florida. Got up to about 90, but there was a slight breeze, and all the equipment worked well. We got solar panels and a charging unit to charge all the equipment. First gentleman, Bobby Perdomo, was a fascinating man. He came back from addiction, is bouncing back and helping others. Jack Catanzarite, assistant, his PA, works on the back. Very interesting discussion about myths and how to better help the back. Michael Johnson. There's a dying language called the Gullah. It's in the Low Country. For those of you who are not familiar with the great area of Charleston and Kiowa, that whole area of South Carolina, it's called Low Country. And there's a language there that's spoken only by 250,000 people. And it's still trying to live and preserve and move on. And Michael Johnson was talking about that. It's fascinating how these languages live on. The Smithsonian Institute has acknowledged it. Joel Chadnow, fascinating. Joel is a teacher in his core. He's very much into wellness. Fascinating stories. He teaches at the community college here, and his road to wellness, what it took to get him there, and why he was just a teacher. What happened in that pivot to make him just that. Ray Bazares was in the Navy, became a minister, a pastor, and some of his challenges there during that transition. He wasn't the best when he was in the military, and what he had to do to get over that to continue his life. Great conversation. Charles Jacobs, my goodness. When he was in the military, his troops wanted some kind of path to success, to life. So he made this line in transition, this whole complete system, this paradigm that he's created. And he walks people through it, and it's absolutely wonderful. I can't wait for you to. Russell Graham, fragrances. I know very little about this subject. I let others do that for me, but he is a professional at fragrances. He did serve time in the military. He's out, talks about discovering them, what it takes to do with them, how to apply them, how to use them. He's got great stories about that. My last conversation was with Jordan Trowbridge. He's got great things to say about the Florida Everglades, and he's into animal rescue. He loves reptiles. We talk about the python issue in Florida in the Everglades, and fascinating young man who's engaging, very, very smart, and boy, the world is his oyster. Great day at the Winthrop Market. Thanks so much for listening and watching. Hi, I'm Joey Pinz, and here's my 45-second introduction. After starting my business in the 90s, I started developing poor habits of eating in my diet because of working way too much. I found myself at 340 pounds. The doctor told me if I don't lose the weight, I'm not going to see my daughter graduate. I took the next 7 months, lost 130 pounds. People ask me, how'd you do it? What's the secret? I need to lose weight. How'd you do it? How'd I lose the weight? Just one word: discipline. I've had other successes in life, and I attribute them all to discipline. Now, I'm not the king of discipline, but I believe that it can help all of us. Friends convinced me to start a podcast. The podcast mission: how do we better ourselves and society? I talk to interesting people in health, fitness, sport, wellness, business, technology, science, art, and culture. And I eventually ask them how discipline plays a role in their life. Podcast vision: growth through learning from others. You work with is it spine injuries, Jack?
Spine surgery, so it's a lot of elective stuff, but we're dealing with a lot of people with chronic pain in their lower back, chronic pain in their neck, and it involves a lot of minimally invasive stuff such as fusions. When I mean by minimally invasive is we don't typically open up a large portion of the body to do the work, but we do a lot of fusions. as well as disc removals between the spinal segments to relieve people of these radiating pains and numbness and burning that they may be feeling in their arms or legs. But a lot of the stuff that we do prior to that is conservative measures such as injections and physical therapy, and we try to exhaust that before going to any form of major surgery.
Surgeon wants to cut, right? And so a lot of times it can be help before surgery.
Yes, sir. So it's the beauty of spine surgeries. It's a step-by-step process. So you go physical therapy, any medications that may help, a brace for people with lower back problems, and steroid injections. And if that all fails, then we go, okay, should we, go into the conversation of surgery? Will that help in the long run? But, that comes with its own risk of problems. So, we try to exhaust all the conservative stuff first and then approach that path when it comes.
Okay, tell me about the backbone. I mean, it's a complicated. There's discs there. I mean, why would anybody want to remove a disc? What are some of the myths about your backbone?
Yeah, so there's a lot of things that you see just from an x-ray. And quite frankly, a lot of the time, people may have really abnormal x-rays, but they feel fine. And what I mean by abnormal is you can have a lot of arthritic and degenerative breakdown, whether that be the cervical spine, the thoracic, or the lumbar, because it is broken up in 3 segments. And a lot of people will have just like over time with this degenerative breakdown, they'll have straightening of the spine, and that'll cause a lot of stiffness in your neck. We see that a lot in the cervical spine. Things called a spondylolisthesis. It's a slippage of a vertebral body. And, that can cause a lot of problems with radicular symptoms. And what I mean by radicular is shooting pains down the arms, numbness in your fingertips, weakness with handwriting or dexterity changes. And a lot of time when, we do the injections and it works, but it doesn't help, then that makes surgery much more attractive.
Interesting. How can it work and not help?
I would say that most people, when you have an impingement of a nerve, that's when a nerve is impinged, it's damaged, and you can decompress the area, but most likely that nerve is never going to truly heal back to 100%. And unfortunately, the 3 pillars in life to make you healthy: eat well, exercise, and don't smoke. And unfortunately, a lot of people, as we try to encourage them to do the 3. Because the peri-operative, so the risk during surgery as well as after surgery, go up whenever you're overweight, you don't exercise, and you smoke a lot. So a lot of people may have these surgeries, but their bones are weak. So they're, they may have adjacent sections that break down because their bones are weak. And when you smoke a lot, you have delayed wound healing. And a lot of people will have really bad pains and be on these chronic opioids and just never really truly control their pain. And they deal with this chronic pain for quite some time and just do these multiple surgeries over and over again.
I would think sleep would be one of the pillars.
So I agree, not necessarily, the objective physical nature of the spine. I think that sleep helps with with many other areas in life.
I see.
If you don't sleep, neurologically, you're going to be, incapable of doing a lot of things in life.
Right.
So, for my line of work, sleep is important, but not one of the pillars that I speak with my patients about.
So, what are myths about the back that people should dispel? Should not know. Should understand.
Myths about the back. Okay, one, a lot of people ask me, is there something that are there treatments with, can I make arthritis better? I can make arthritis better by doing so, and so. And the reality is, arthritis happens in everyone.
Right.
And, as a 24-year-old who lifts a lot, in 20, 30 years, I'm going to have back problems too.
Right.
And unfortunately, it's something that you can't avoid, and you can only manage it. So, the myth, you may have people saying we can treat your back, we can fix your back pain. We can't fix it, we can manage it. And it's a matter of, are you living your day-to-day life and performing and having a quality of life with a tolerable pain baseline, as opposed to being out of control? Because some people can survive on a 1 to 2 out of 10 rating pain, but you can't do your everyday living on a 8, 9, 10.
Right.
So that's one big thing. It's we don't cure arthritis, you control it.
Yeah, arthritis is a big one. Diet, exercise, and don't smoke. How does your nutrition help with your back?
Yeah, so it's hand in hand with exercise and diet are hand in hand. So when you eat a lot and you don't exercise, you gain weight.
Right.
Okay. So the people who are very morbidly obese, and I'm talking over 40 BMI, 45 BMI, one, it may be risky to even do the surgery anyways. And two, and like I said, the perioperative risks with obesity are soar through the roof.
Yeah.
So a lot of surgeons won't even do surgery on patients who are 45, 50 BMI above.
Wow.
And another big thing with post-operatively, so after the surgery, we want you to move. You have to keep moving the body, because if you don't move the body, your risk of stroke, heart attack, clots, it goes up. So when you're not, when you're not fit, when you're not, your body is just not naturally ready for the surgery, then it's just going to negatively affect you down the road.
Is it interesting that you use BMI, because that's just height divided by weight? What if there's some athletes that would, there's some running backs
a lot of the time
with 4% body fat that would be obese on that scale.
Yeah, and I understand that. I'm actually considered obese, but I don't find myself to be obese.
Yeah.
It's really kind of just it's natural look to it.
I see.
A lot of people will do kind of abdominal circumference. But if your BMI is 40, 45, 50, it really disregards an athlete, because an athlete's not going to be a 40 BMI.
Right. So Jack, what can we do for better back health other than the diet, exercise, and not smoking? What are some other things that we should be doing to help our back?
Yeah, so it's all about mechanics. I know a lot of people who don't know how to properly lift objects, and you see that in a lot of older men, or even middle-aged women, or kind of young women who will pick up an object bending from the back,
right,
as opposed to bending from the knees. So you can work out as much as you can, but if you don't have the right fundamentals, you're going to hurt yourself in the process of doing the exercise. So it's all about bending the knees. Don't pull through your back, and because a lot of people will have herniated discs because of bending something super heavy through their back, as opposed to getting close, bending down with the knees, and keeping your back straight and lifting straight up. So I think outside of those three, fundamental mechanics is a game changer down the road.
I did a lot of CrossFit, Jack, and boy, they just you never bend over like that, and lifting from the knees on everything. How about just sitting up straight? I mean, many desk workers, right? I agree. Welcome. I'm Joey Pinz, and I'm thrilled to guide you through this course. Discipline for Greatness, unlocking your best self in 7 days. Whether you're here to take the first step toward a better you, or looking to build on the momentum you already have, you're in the right place. This course is about real change, not fluff. Let's get started. This course is based on my book, Discipline for Greatness, 5 Steps to Success and Happiness. It's the product of decades of experience, and more importantly, conversations with hundreds of incredible people on the podcast. In the next 7 days, we'll focus on building purpose-driven habits, creating a balance in every part of your life, and activating the full power of discipline. You'll walk away with more clarity, more control, and real confidence. This course is based on my book, Discipline for Greatness, 5 Simple Steps to Success and Happiness. It's the product of decades of experience and, more importantly, conversations with hundreds of incredible people on my podcast. In the next 7 days, we'll focus on building purpose-driven habits, creating balance in every part of your life, and activating the full power of discipline. You'll walk away with more clarity, more control, and real confidence. Here's what to expect. The course runs for 7 days and 2 short episodes each day, 10 to 15 minutes max. It's fast, focused, and meant to drive real transformation. Each day builds on the last, so grow consistently. We've packed in reflection prompts, guest stories, and short quiz at the end of each day to help lock in the learning. Make sure you have your companion workbook ready. It's your space to journal, reflect, and take action. This just isn't information, it's transformation. You're going to be challenged. You're going to be supported. Most of all, you're going to be inspired. Discipline isn't about restriction. It's about unlocking potential. My job is to help you discover yours. Now you might be wondering, why did I create this course? Because I know what it's like to want more in life and not know where to start. How is this different from other content? Because this isn't about hustle. It's about harmony. What if I fall behind? No problem. It's designed for your flexibility. Do you need to read the book first? Nope. But if you do later, it'll reinforce everything here. And how do you get the most out of the course? Stay engaged. Use the workbook. Reflect. Commit. And finally, what if you don't see results right away? Be patient. Transformation takes time, but every small step counts. You've got everything you need to start strong. So take a deep breath, shake off the noise, and let's get started. Your best self is just 7 days away.
A lot of people with bad posture.
Yeah,
I have bad
hunch.
posture.
Yeah.
I hunch over every once in a while.
Yeah.
I try to compose myself to pull my scapula back,
Right.
put the chest out, and there's actually a lot of restaurants where they'll have a bench, and it kind of forces you to lean
Right,
over.
it is nice. Yeah.
And not only is it bad for your back, but also people will be like, oh, he looks like he has bad mechanics. You know what I'm saying? So keeping your back straight, walking without a hunch, just being cognizant of it. If you work in an office and you're sitting for long periods of time, I think a brace would help a long way, just to go on Amazon and buy. And not waiting until you actually have the pain to do something about it.
Right.
So.
And ergonomics play a role. You want to get something that lumbar support on your chair.
Yeah, ergonomics. But some chairs can really make you want to curve over,
Right.
or like the back pad of it makes you want to because it's uncomfortable or something like that. So there's a lot of ergonomic chairs and braces that kind of just force you to stay upright. But also being aware of it, that the more that you hunch over and the more that you do things that are going to roll your shoulders is just going to negatively affect you down the road.
What's the term throwing out my back, Jack? What does that mean when somebody throws their back out?
Throwing out your back. When people say that they throw out their back, I tend to think that they pulled their back, they pulled a muscle in their back.
I see.
They did a movement, and the muscles, the striations of the fiber, the muscle fibers, they're pulling to a point where on a microscopic level they're stretching and they're tearing. There's a difference between a muscle sprain and a muscle strain. So a muscle strain is when you kind of tear your muscle fibers. Sprain is more when you pull a ligament. So a ligament as in your foot, your ankle, and then a strain being I pulled my groin. There's muscle fibers there that are tearing, and you kind of have to heal longer because it hurts more.
Wow. And so Jack, I get back pain. The last 2 or 3 days, I do a bunch of stretching, some yoga, Cobra, these kinds of things, and then it just disappears. I don't do anything to enact it. It seems it's just all of a sudden it kind of comes on, and it's only been happening once a year. But I know I'm not on 56, happening a couple of times a year. And you must hear this story a lot. What happens there?
Yeah, I mean, typically when I work with patients, if they are being diligent with exercising and stretching, They don't really stop. But, people may have, if you have local pain that's within the spine, it typically doesn't go away unless you're consistent with it. Think about muscle, building muscle. So if I'm working my chest every day and I'm getting stronger and stronger, if I stop, it's going to start, getting smaller and smaller and smaller, and I'll eventually notice it at some point. With exercising, you can exercise every day for your back, and your back pain gets much better, and then you stop, and then you start, you be less cognizant about like those fundamentals, like we talked about, those fundamental mechanics, and being diligent with the exercises, and it'll start to come back. And that's when you are kind of in a situation where you may hurt yourself because you're not being diligent about what you were doing about 5 months ago, 1 month ago, whatever it may be.
Should somebody routinely see someone like yourself, even if there's not pain, to be proactive? How can you be proactive with back pain?
Yes. Can you ask me that again, please?
Can you be proactive in stopping back pain from happening? Like, should you start seeing somebody like yourself to stop? If I have it and it comes and goes every once in a while, is there something I can do to actually prevent that?
If you would come to, let's say, my clinic and say, I'm having this lower back pain, it comes and goes, I'm not having any ridiculous symptoms into my legs, no numbness, tingling, burning, and when you press on my back, it doesn't really necessarily hurt, but your muscles are tight around the area, I would probably just do physical therapy then see you in 4 to 6 weeks and see how you're doing. But also, I can schedule you for physical therapy and you don't do it, and then you're like, hey, my back still hurts. Well, you didn't do the physical therapy, or you did the first evaluation and you're not being consistent with the exercises outside of those appointments. So
that'll do it.
Yeah.
So we're here at the Winthrop Market here in greater Tampa Bay area. What's some of your goals here this morning, Jack?
Well, I'm actually golfing on Sunday, so I'm trying to get a lot of my chores done today. Grocery shopping, cleaning my bathroom, and getting everything out of the way so I don't have to deal with it tomorrow.
Very cool. Has there been anything in the last month or so you changed your mind on?
Not necessarily changed my mind, but open up to. I'm from, like we talked about before, I'm from Pittsburgh, so I just moved down here in January, and the big thing with moving to a whole new area is meeting people and putting yourself in positions to meet people.
Right.
I will say I struggle with that. I was fortunate enough to rekindle with a friend from college who lives in St. Pete, and he had invited me one day, and I met all of his friends since he had been down here for a year. So I have a good friend group in St. Pete, but I don't necessarily know a lot of people in Tampa.
Interesting.
So I haven't changed my mind on this topic, but it's life's kind of too short, so you got to put yourself in situations that it may be a little uncomfortable, but open yourself up to meeting new people.
Good for you.
I try to go and just get dinner, at different areas, and sometimes I don't talk to anyone and I have a good dinner and I leave, and sometimes I have a good conversation with someone next to me or the bartender, and I meet a new person and I leave with my shoulders high. So
it's tough because you've been in Pittsburgh your whole life.
I have, and everyone I know is in Pittsburgh, right. So I'm fortunate that I have the people in St. Pete, but I'm trying every day to open up to put myself to seek discomfort.
Good for you. Good for you. So I started my business, Jack, in the 90s. I was working a tech firm. I was working way too hard, putting my health in the back seat. Next thing I know, I'm in front of the doctor. She tells me that I'm 340 pounds. Geez, what would my BMI be at that, by the way? It'd be up there. I was at 340 pounds, and she says to me, if I don't lose the weight, I'm not going to see my daughter graduate. My daughter was just born. Scared the hell out of me. Spent the next 6-7 months, lost 120 pounds,
kept it off. You can't look at it as a finishing line, these kinds of things. You know, it's lifelong changes. So when people ask me, how'd you do it, what's your secret? I say no secret, discipline. That's how I did it. Focus, willpower, restraint. How does discipline play a role in your life, Jack?
It's a great question. And I'll kind of open up a little bit since we're having a good conversation. But in the summer of 2015, my cousin, his name is Michael Trella, he's 15 years old, and I was in my 6th period English class, and I got a phone call. My teacher got a phone call and told me that I had to go down to the principal's office with all my books. And at the time, I didn't know what was going on. They brought me in. They told me to sit down. No one had really spoken anything to me. And the principal brought me into his office and said, I don't know how to tell you this, but your cousin passed away. Died in his sleep from a suspected cardiac arrest. And that was probably the lowest point of my life. So, you know, we have a foundation where we raise money for families who lose a child. It's called the Michael Trella Foundation, and you know, it's kind of to help with the cost of the funerals. But you know, you talk about discipline, and you know, I watched my aunt, you know, grieve over her son, and you know, the thought of that happening to my mom is worse than anything that I would personally do to myself. So, you know, I try to live every day like it's my last, because life is short, and that's why, you know, I be myself. I don't change who I am. I care about, you know, being active, not putting myself in a position where I'm going to get sick sooner rather than later. And it really is a driving factor with my job and being in medicine and being a PA, talking to people every day. And I wake up every morning just thankful that I see the sunrise, and that's what kind of drives my discipline to, you know, push more than I did yesterday. So.
Yeah, when a family member dies like that, it's very tough. Did he have any siblings?
He has 3 brothers.
Yeah, and the toughest grieving, of course, are the parents. Seeing a child that's passed, an offspring, it's horrible. What motivates you now, Jack?
What motivates me? Actually, really what motivates me is my friends. And when I mean my friends, I have a really strong group from college that I still talk to every day. And, you know, we keep each other updated about every month about what we're doing and where we are in life. And I wish nothing but the best for all of them. I want all of us to succeed. But also, it's, you know, it's a little bit of a competition. So, you know, if I see one of my friends doing well, you know, it pushes me to work harder because I want to be at the same level that they are. And it's not, I don't wish what they don't have, what I don't.
Right.
It's more of, you know, I'm so passionate with where you are in life that I want to be just as good as you, if not even better. So it's holding each other accountable, and that's what kind of keeps me motivated every day.
So given your friends and kind of the impact with them, how do you measure success, Jack?
I'm really bad at that. I'm too hard on myself because, you know, even when I graduated PA school, I passed the boards first time.
Wow.
You know, and I just, you know, I did it, and it's like, did I do it? Was that enough? Like, am I successful just from that alone? And I need to tell myself more that it is. And I just, that's something that I need to ponder more and work on more, is what is that level of, what is your success? What is your success level? So.
Well, I appreciate your time today. So if people, this charity that you have, you want to mention it?
Yeah, it's the Michael Trella Foundation. We're based. It's the I Love You More the Michael Trella I Love You More Foundation. We're based out of Pittsburgh, and we do events all year round. But we have our own website. You can look them up on Instagram. The I Love You More the Michael Trella Foundation. If you look it up on Google, you look up that on Instagram. Learn more about Michael's story and our story as a family and how we've grown from it and how we're impacting many other families throughout the years. So.
And Michael Trella, Trella.
Trella, yes. Michael, Michael.
Excellent. Very good. Jack, I appreciate your time today. Thanks so much.
Thank you. Thank you for having me.
Thank you for listening and or viewing Joey Pinz Discipline Conversations. Please share this episode with one or two of your friends who you think may benefit from the episode. Our website, www.joeypinz.com. There you'll find lots of resources and you could join our mailing list. Please follow us on all our social media, Instagram, Twitter, and Facebook. Podcast information, the video version of our podcast is on YouTube. Please subscribe. Audio is on all major podcasting platforms. Please follow them. And if you like it, please consider giving 5-star rating. Would really appreciate that. Thank you again for listening or watching Joey Pinz Discipline Conversations.